Welcome to Children's Hospital New Orleans. We know that often being in the hospital can be a stressful experience for both kids and parents. It is our goal to support families and maintain a healing environment. Follow along now as a few real patients and their parents show you everything you'll need to know about your stay.
Hi everyone! We wanted to give you an idea what it's like to stay at Children's Hospital New Orleans. While you're with us in the hospital, everyone is here to help you feel better. Your whole team is working together with one shared goal, providing extraordinary care to get you back to feeling like a kid again. Your care team will round or visit you every day and make a care plan just for you. While you stay at the hospital, here are some of the people who might be in and out of your room. Your doctor, as well as resident and attending physicians, therapists and nurses, child life specialists and social workers, environmental services technicians, and you may even see medical and nursing students learning to be the next generation of doctors and nurses. Also, parents and guardians, you are a very important part of your child's care team, so your thoughts are welcome. Your room is where you'll be staying while you're here at the hospital, so here are some things to know. We have lots of channels on the TV in your room, including Channel 76, where you can learn everything you need to know about staying at Children's Hospital, and even live stream special events if you can't leave your room. If you want to get connected when you arrive, you can tap into our free guest Wi-Fi. Your room will be cleaned once a day. If you need an additional clean or any extra services, just call the Sidekick call center at extension 83080 from your in-room phone. Extension 84367 will reach your social worker if you need financial assistance or have any other questions about your hospital stay. Just a reminder that we have a no wipes in the pipes policy, so please make sure that you throw any baby wipes into the trash and not in the toilet. Here are some other important things to know during your stay to keep everyone safe. Once you get an identification armband, please be sure to leave it on while you're in the hospital. This is a way for your doctors and nurses to make sure you're getting the right medicine and treatments. One of the easiest and most important ways to keep yourself and others safe is by washing your hands often with warm water and soap. Your care team will do the same. Parents, please check with your nurses before bringing any medications from home, and be sure to let them know if your child has any allergies. So that you don't fall down, follow these easy rules. When in bed, leave your bed in the lowest position with the side rails up. If you have a yellow fall risk bracelet, be sure to always wear it. Don't be afraid to call for help before getting in and out of bed. And make sure you're wearing the yellow socks that have the special grippers to keep your feet on the ground. Use the pull cord if you need help in the bathroom. And if mom or dad ever needs to leave the room, they should let a team member know. Parents, if you have concerns that you've shared with your nurse, doctor, or another member of the care team that you feel should be escalated, please call our Prevent a Code team at extension 83228 on your in-room phone, and a special team member will respond within 15 minutes. I bet mom, dad, or other visitors might want to stay in your room with you overnight. If you're staying in the ICU, please check with your nurse about sleeping arrangements. All other units can have 2 caregivers stay overnight, unless you're sharing a room with another patient. Any caregiver staying overnight must be at least 18 years old. We love welcoming visitors to the hospital, so here are a few things you should know. Visiting hours are 8 a.m. to 9 p.m. At Children's Hospital, safety comes first. so anyone under 18 should be with an adult. And during flu and RSV season, children under 12 won't be able to visit the units. There's parking all over campus for patients, families, and visitors. If your visitors use the parking garage, they can come across the Sky Bridge and check in with one of our greeters. All visitors are required to check in daily and will receive a visitor badge, which is a different color each day. You can also check in at the main entrance front desk. Getting around the hospital is easy if you look for the musical instruments. When you come off the Sky Bridge, you can take the drum elevators to the CICU, or the piano elevators down to the first floor. To get to inpatient units, take the saxophone elevators, or the trombone elevators. There are loads of places to visit all around the hospital. Let's have a look around and see some of the spots you'll want to know when you're here. Our first stop is the Chinola Cafe. Your family members or visitors can stop by for breakfast, lunch, or dinner here. And we're always stocked with snacks 24/7. For our patients, meals will be delivered right to you at these times. In between meal times, there's an all-day limited menu with things like burgers, French toast sticks, and more. Next up is the Family Resource Center. This quiet lounge area is a great place to take a break or get work done. You'll also find an office space with computers and printers, as well as services for families like Medicaid enrollment and other community resources. Our next stop is always a favorite, Leola's Gift Shop. They have all the essentials here, from toiletries and phone chargers to over-the-counter medicines. And best of all, loads of gifts and toys. You'll definitely want to make a stop. At the Hellas Foundation Memorial Chapel, you'll find a peaceful place if you need to pray, reflect, meditate, or just take some quiet time. The Interfaith Chapel is open 24 hours, and if you need to request time with one of our chaplains, let a nurse know. Take the saxophone elevators to the second floor to get to our Child Life Playroom. Or if you can't leave your room, Child Life specialists also visit inpatient areas. These team members can help you understand why you're in the hospital and make being here extra fun. The Child Life Playroom and Teen Lounge are full of toys and games just for you and your family. Some days we even have special events you can come to or watch live in your room on Channel 76. There's a lot to see around the Chinola campus. The beautiful green space and walking paths are perfect for a breath of fresh air. But did you know there are 2 family housing centers here on site? Some patients travel from across the Gulf South to get care at Children's. That's why the Hogs House Family Center and Ronald McDonald House are here to provide a home away from home during their treatment. Check with your social worker to see if these are an option for your family. Then there's Hale's Cottage. Families and visitors can come here to get coffee and pastries, and it's a nice place to hang out inside or out on the porch. Now let's make sure you know what to expect when you're almost done here at Children's Hospital. A member of your care team will walk you through those final steps to get you home and make sure you have everything you need, including prescriptions, follow-up instructions, and more. We even have a pharmacy on campus and can have your medications delivered right to your room. Your nurse will give you an after-visit summary. Mom or Dad should read through and ask your nurse if they have any questions. And remember, Children's Hospital has clinic locations across Louisiana and the Gulf Coast for follow-up care close to home. Be sure to check out your nearest clinic at chinola.org/locations. Make sure you register for my chart before you leave at mylcmchealth.org, where you can access all your health records, message providers, pay bills, and more. That's it! Now you're all set to go home and get back to being a kid. Thanks for listening, and let us know if there's anything else we can do to make your stay more enjoyable at Children's Hospital New Orleans.